This video will demonstrate continuous enteral tube feeding. Has a lot of similarities to intermittent tube feeding, but also some differences that we want to make note of. So figured we'd make a video to get you guys comfortable if this arises in clinical. So first thing we want to do prior to entering a room, again, we are reviewing our physician's orders, making sure we know the correct rate, have the correct formula, and are following physician orders for the continuous tube feed. We also want to verify patient allergies. We want to verify the patient's weight, review their lab results, check their vital signs, and then we are going to complete that focused nasogastric tube assessment. For time purposes, I'll have you guys refer to the nasogastric tube assessment video for further information there. But keep in mind, number one priority, we need to make sure that this NG tube is in the same place as it was in the previous assessment. We want to review that chest x-ray or abdominal x-ray to make sure that we have visualization of the nasogastric tube in the stomach and we are comfortable with the placement. So first thing we need to do is gather our equipment, get the bed to a workable position, verify our patient, and all those initial steps that we do prior to our skills. So for this procedure, I have my irrigation tray, I have my basin, and I have my 60 ml syringe, and then we have some clean water available. I also have my continuous tube feed bottle ready to go, and then my continuous tube feed tubing. And then you're also going to have a tube feed pump that will be connected to your IV pole that will demonstrate through pictures here in a moment. So first thing we want to do is, again, workable height, get that side rail down, and we want to check placement with gastric content, and we also want to check that gastric residual volume. So remember, we are clamping our NG tube, removing the blue port here, connecting our 60 ml syringe, and we are pulling back, again, looking for any gastric content coming up the NG tube. While we're at it, we're going to continue to pull back, and we are going to check for gastric residual volume. We're doing this before initiating any type of feeding, and then routinely if they're getting continuous tube feeding. So keep in mind, anywhere between up to 500 mLs, we want to make sure we are returning to the stomach to maintain that fluid and electrolyte balance. But again, making sure we're checking our institutional policies and understanding what our policies and procedures say is appropriate. You also may want to review physician orders. Some physicians may specify how much gastric residual volume that they want to keep. So we will return that 30 mLs of gastric residual volume. We know the patient is tolerating previous feedings okay if they've had any. We have confirmed placement. I'm going to clamp, remove my syringe, and replug. Now I am going to draw up 30 mLs of water. Again, remembering anytime we are initiating a feeding, we have to flush before and after. So we'll clamp, remove the blue port, connect our syringe with water, and we're slowly going to infuse that 30 mLs to clear everything throughout that tube. Clamp one more time, replace our blue port, and we have confirmed placement, we have assessed gastric residual, and we're ready to initiate our feeding. So again, making sure we've completed our full GI assessment, our full NG tube assessment prior to doing any of this. Explaining the procedure to our patient, making sure we have a towel here again just to keep them clean. Making sure our head of the bed is at least 30 degrees, preferably 45, but at minimum 30 degrees. We have checked our labs, monitored our weight, everything we need to do beforehand. Next, we are going to take our tube feed formula. Comes in a bottle like this. Lid pops off, and you'll notice it has a little kind of plus side opening, and that is where our tubing is going to connect to. Right now it's sealed. Nothing can come out until we spike it with our tubing. So we will hang this on our IV pole. Once we hang it, prior to spiking anything, we want to make sure we are labeling our tube feed. We want to make sure we're labeling the initials of the nurse starting it. We want to label it with the date and time that we are starting it as well. And then it doesn't hurt to put the ordered rate If I can get you close to the camera here, you can see these tube feed bottles actually have that information um, to write in on the bottle on the top right there. So if we write down the rate that it's supposed to be going, it's a good way for the oncoming nurse after we leave to make sure that it is going as ordered. So we have labeled it, and these bottles, once spiked, are good for 24 to 48 hours. Again, it depends on your institutional policy. The bottle itself says if spiked and left connected, it is good for 48 hours. If at any point we disconnect the tubing, then it's only good for 24 hours. Next, you're going to get our tubing. And you'll notice we have a purple spike that we are going to connect to our tube feed bottle. And then we have our opening that's going to connect to our NG tube. So what I'm going to do is take my spike. I'm going to get it into the bottle, and I'm going to twist until I feel a click. Once it's clicked, then I know that I have spiked that bottle appropriately, and now I want to leave this connected, otherwise you might have a little bit of a mess on your hands. From here, we are then going to prime our tubing, and I'll show you how to do that. But we also have a label on our tubing. The tubing we want to label with the date and time that it has spiked the bottle, and our tubing is good for that same 24 to 48 hours. Okay, a little bit of an example here. So this is what our tube feed pumps are going to look like over at the hospital for clinical. These are our Enteral Infinity tube feed pumps, and what you're going to see is that the tube feeding, this part will flip open. Get my focus here, and then it shows your tube feed is initially the in part of the tubing is going to go there. It's going to wrap out or wrap around, and the out part's going to go to your patient. Once we have that connected and in place, we're going to power on our tube feed pump. Right here, turn it on, and you'll notice that it actually has a prime function right here. So once we have our tubing connected and inside of our pump, we're going to go ahead and press and hold the prime button, and the tube feed and the pump itself will actually prime that tubing all the way until the end. So we have primed our tubing, making sure it's in the right place. From here, we are going to set our rate. We'll press there, and we want to make sure that our rate per mLs per hour is matching our physician's orders. Okay, so once we have it primed, we have everything labeled, making sure this is in there. Okay, we are going to take our purple end, we're going to clamp our NG tube, remove our blue port, we're going to then remove our protective cap from our tubing, and we're going to connect it to the NG tube itself. You want to make sure you have a good connection here because you don't want it to be leaking on the patient, becoming dislodged. So we want to make sure it's in there nice and snug so that when it's infusing, we know it's going to be going through the tube. I would suggest holding onto this somewhere safe, whether you put it in your irrigation tray. This cap for the tubing would be good in case you need to disconnect it, especially when flushing or checking gastric residual volume. From here, we already have our pump set. We're just going to hit the run button, and we are going to monitor our patient and making sure that it's starting to infuse appropriately. Again, before we exit the room, we want to check on our pump to make sure it's going at the ordered rate by the physician. Some other things that we want to check, or we want to make note of, is when usually these patients are going to they're going to be getting this for 24 hours a day continuously. That's why they call it continuous tube feeding. With continuous tube feeding, we are making sure we're doing our focused assessment, our nasogastric tube assessment every 4 hours. And while doing so, we are also checking gastric residual volume every 4 hours as well. And that becomes even more important with a continuous tube feed because we want to make sure our patient's tolerating the rate okay. They're not developing any gastrointestinal symptoms. They're not having any, excessive loose stools, and they're tolerating it at the rate that it has been prescribed. So by checking that gastric residual volume every 4 hours, we can make sure that they are not, we're not over distending their stomachs. We want to make sure we're marking our supplies, again, noting the date, time, and initials of when we spiked our bottle here, initial our tubing, and then we also want to make sure that we label our equipment as well, which is good for 24 hours. What you'll also have see ordered most often is every 4 hours when you're doing that assessment, maybe every 6 hours, the physician's going to order potentially a free water flush. If there is no free water flush ordered for a specific amount, we are making sure we are going through that process of flushing the NG tube with 30 mLs every 4 hours. So we will pause our tube feed, we will clamp, remove the tubing, and this is why I said that cap is important to hang on to so we don't get this contaminated. We will draw up our water, flush with 30 mLs, and we're doing that every 4 to 6 hours. These patients can be important to routinely assess them. We're making sure that they haven't been laid supine. They will be at a minimum of 30 degrees at all times to prevent any aspiration, making sure we're communicating that with other healthcare providers with a sign above the bed. And that's all for patient safety. So from here, it's just frequent assessing. We have everything set up, and then within that 24 to 48 hours, we are making sure we're changing out our system here. One other thing to make mention that's important to document as the nurse, whether you're leaving for a shift or your tube feed bottle has emptied, we want to make sure we're documenting the total amount infused. And the nice part about these pumps is it actually keeps track of that for us. So right here you can see, you can click volume total. When we press that, it is going to tell us how much volume has been infused since it was last initiated or last cleared. So I'm going to pretend 200 mLs has been infused. I'm going to write that down on my paper, and then I'm going to hit the clear button. That way, the next assessment, whether it be the oncoming nurse or later on in my shift, I know how much tube feed they have gotten between the time I cleared it and documented it until the next time I clear and document it. So we will help you guys get comfortable with these pumps over in the clinical setting. Really the big things to know is that it primes, we press and hold, we can adjust the rate, and that it keeps track of that volume total and that we're clearing it out each time we're documenting intake for our patient. So again, we don't have one of these pumps available to us here at the school, but we will help you guys get comfortable with them over at main campus when we're there for clinical. So after that, we want to make sure we're documenting our procedure. We are returning the patient's bed to its lowest position, performing hand hygiene, removing our gloves, and then documenting all of our patient care in the Meditech system. So that concludes our continuous tube feed video.